And during the pandemic, I understand there's been some regulatory changes. Do you think those will have lasting impact on the wellness industry or mental wellness industry?
Yeah, it's been an ongoing debate with anyone who spends time in healthcare, like which of these regulatory changes will stick and which may go back to the way it was before. I think depends on the day where people land on each individual one, but I think there's a general consensus that these changes have helped far more Americans get way better, faster, cheaper access to healthcare services broadly, not just mental health. Mm-hmm. And so rolling that back would have negative impacts on that. I do think some, folks have talked about HIPAA compliance being relaxed a little bit, the way, data is shared and privacy is maintained. I think that's one where you may see it go back to more of what it used to be, just in terms of protecting patient information. It's still, I think, I would say protected today, but they've just made it a little bit easier to share data across entities so that people can stay home and receive care. But I do think the regulatory changes around Medicare and saying you shouldn't need to have an in-person visit with someone before you can transition to having telemedicine with that same provider. And you can actually start your interaction with a provider through telemedicine. That makes a ton of sense to me and feels like there's no reason why that should go back. You should be able to access medicine however is most convenient and cost effective and efficient for all involved. So that one is one that I'm hopeful will actually stay and feels like there's good tailwinds around that being something that stays.